Welcome back, everyone. So much effort, so much time devoted to stemming the tide, or in this case, the tidal wave that is the opioid epidemic. Here to tell us about a new task force, relatively new, formed at the University of Toledo back in November, aimed at addressing the problem really from all angles. The co-chairs of said task force, Doctors Amy Thompson and Linda Lewandowski. It's great to have both of you here today. Thanks for coming in.
Thank you. Thank you.
I mentioned task force formed in November, a big summit back on April 10th, not too long ago. So I would ask you, as far as that, from the start of the task force to the summit, how's it going in the progress? What is a monumental effort? And Dr. Thompson, we'll start with you.
Well, we have been very, very busy. First of all, I think it was a wonderful idea for President Sharon Gaber to have this idea of creating a task force that is heavily needed in our community, that's stemming from the university. And the whole goal of this task force really is to bring partners together with faculty and anybody interested in this particular topic of opiates and substance abuse in the community. And we really started initially by just finding out who was interested and who's working on this. And I think we were surprised by the depth and volume and the talent.
Everyone is.
Everybody is.
Right?
That's right. That's right. And so we were able to kind of create an expertise database and find out who was interested and then bring partners together and start planning an opioid summit that occurred a couple weeks ago. And our big charge is just creating synergy and creating partnerships and really engaging with the community and finding out what our needs and our gaps are.
Dr. Lewandowski, we mentioned that we said everybody's working on something, but the key is that you have to bring these people together on who's doing the work and how it can impact everybody in a positive light down the road here. So tell us how you're bringing people together here.
Well, you're right. It's such a big problem. It really hits across all demographic levels, all socioeconomic groups, all racial and ethnic groups. And for our university, we're finding we have faculty, researchers, and clinicians in every aspect of the university. From certainly we think of the medical center and our detox unit and our clinicians, but we have researchers that are looking at drug-addicted babies. And we're interested in children in foster care, certainly treatment models, opioid receptors.
Opioid receptors, maybe.
So those are like, the cellular level where the drug goes down and acts, and how can we have better ways of having drugs work most effectively? And one that we were kind of surprised about is looking at opioids in water. When we flush those opioids down the toilet, they go into the water system, and what happens after that.
Another aspect.
Yeah,
another impact,
and so it's so we have really been seeking out all of the talent and expertise that we have in the university level, and then we have been out meeting with the Commissioner of Health, the Sheriff, with a lot of community leaders who've been already very active in addressing this problem, and looking at what are some ways we can really dovetail our expertise at the university and really helping address these public health problems.
And what about education at the lower levels, at the younger levels? Dr. Thompson, speak to that.
Sure. Well, obviously, the earlier we can start in prevention, the better. We're actually just fortunate that in a partnership between the Department of Nursing and the Department of Public Health at the University of Toledo, we just were awarded some funding by the Cardinal Health Foundation to target younger students on safe prescription and getting them to think about the risks of taking medication that's not theirs or abusing that. So I think the earlier we can start getting people to think about that these are dangerous drugs and medications, the better.
Is it a case where we used to tell kids don't smoke, right? Smoking is dangerous. Could eventually kill you. Is it a case where now you bring opioids into the mix?
Well, it's a matter of really educating children about, first what's medicine and what's candy, at a very young level, but then looking at, what's medication that's helping you, that is something that's good for you. It will help your or your pain or whatever.
Right, that's what
versus, it's there. It's medication is not bad.
Yes.
It has to be used appropriately. And so helping children learn, what is appropriate use, helping caregivers learn how do we help our kids learn, but also how do we do simple things like store our medications appropriately. So having a medication prescription in a grandparent's medicine cabinet when they're young children who can come in and really look in the cabinet, it's kind of, a risk factor. And that could be fixed by getting a less than $20 storage box for medications. You know, you can get those in drugstores or on the internet. So sometimes we just don't think about how we might be having risk factors in our homes that we could easily address.
And Dr. Thompson, maybe you can speak to screening for risk factors. Who is at risk? Dr. Lewandowski talked about, you know, opioids and pain medication. If you have surgery, I want to, you know, ease my pain a little bit. So it is a good thing. But what are some of the risk factors, and how do you screen for it?
Sure. Well, first of all, I want to say that every demographic is at risk for opiate addiction. We see this happening in, you know, high schoolers. We see it happening in young adults, one of the largest demographics that's affected by overdose. We're seeing a spike in older adults who can't, you know, get access to their medications or can't afford it, that they might be purchasing street drugs.
It becomes the heroin situation, right?
Heroin.
It's cheaper than prescription meds sometimes. Absolutely.
And so, you know, there's many ways that we can look at this. One, from a prescriber standpoint, following the prescription path. And, you know, is this an individual that's doctor shopping? Are they going from place to place getting multiple prescriptions? The way that they approach their physician, you know, are they asking for specific medications and a certain dosage? You know, there's red flags. If you're going to get a dental procedure, you probably shouldn't out with a 30-day supply of oxycodone. So looking at risk factors of, you know, have they had any previous addiction? Have they had chronic pain, for example? Do they have other substance abuse addictive behaviors? We often see that there's gateway drugs that might end up resulting in opiate or heroin addiction.
For instance, like what?
Well, there's been some studies to link things like marijuana use or other types of illegal substances, and kind of working the way up the chain to then actually have an opiate or heroin addiction.
All right, soon to be legal, by the way, and from a medicinal standpoint here in Ohio, and legal from a recreational standpoint in some other states. So we know about that. Going forward now, the task force formed in November. Is this an infinite situation? The problem doesn't seem like it's going away.
No, it's not going away. Unfortunately, we've been working on it. You know, the public health, like everyone is working on it. You know, from the sheriff's DART team, which is an incredible resource, national model.
Recognition.
Absolutely. You know, there's been a lot happening out of the health department. There's a lot of things that are happening. Unfortunately, our numbers of overdoses and deaths are not going down. And so we know that we need to do more. So we're not really time limited on, you know, we feel like we're just getting started. And we really want to look at how we can leverage our resources really to start bringing those numbers down.
Is there more federal money out there? You talked about grants that you're getting. So that process in continuing to fuel what you can do.
We've been very fortunate in our state because of the level of overdoses that we've had, that there is federal money coming down the pipeline. There's going to be state money coming down the pipeline. And that was one of the ideas behind this task force, is to be able to organize and apply for some of this money in Northwest Ohio. And, you know, I think it's important to piggyback on what Dean Lewandowski was saying, is this is something that we've never seen before in terms of epidemic proportions. In Northwest Ohio, we're seeing 3 people die every single week from heroin, and nationally, 122 people die every single day as a result of overdosing. So this is something that is all hands on deck. We've got to bring everybody together to help solve this problem and get funding and create programs. And, you know, one of the other issues is this is a very difficult drug to remain free from. There's a lot of relapse in terms of, you know, going through detox, and so there needs to be some creative strategies for this.
All right, well, press on with the work. We've got to wrap it up right there. I mean, we could talk for hours about this, and you will. You have another, well, you're going to meet with the community members coming up in just a few weeks as well. But we thank you for coming in. Good luck on the work ahead with the UT Task Force, the co-chairs of this task force, Drs. Linda Lewandowski and Dr. Amy Thompson. Thank you so much for coming in. We appreciate it.
Thank you
for inviting
having us.
Okay, we're going to come back on Conklin Company in just a minute. Stay with us.